Hello, how are you doing? My name is Napa Ratchudi, and this is my friend Sasha Bayes. We are going to talk about the deep vein thrombosis or DVT. What is deep vein thrombosis? Deep vein thrombosis or DVT is referred as a venous thromboembolism. It is a blood clot or thrombus which occur in the large deep vein in the body and usually in the legs or pelvic area. Case study that we have today, Mrs. A present to the operation room with a broken left leg which occurred while working. She is 48 years old, white female with a history of smoking and alcoholism. She is also present with a medical history which include obesity, hypertension, stroke, and high cholesterol. She's on lisinopril and atorvastatin for high cholesterol, and in the OR, the procedure is explained by the surgeon and the consent is signed. In stage 1, patient is in the operation room for repair of the left fracture femur. Her vital sign is temperature is 98.2, heart rate is 102, oxygen saturation is 98%, blood pressure is 160/90, respiration is 20, and objective, patients prepare for surgery. The subjective part, patient states that she is anxious about her surgery. The intervention for the stage 1 is the preoperative interventions, which include TED holes or sequential compression device or SCD, position patient for the surgery by avoiding reverse Trendelenburg, and ensure patient safety, especially the airways for anesthesia. The question for the stage 1, what factor that place the patient at risk for developing the DVT? And what were the preventative measures performed in the preoperative phase for DVT prophylaxis? The answer is patient present with the long bone fractures with a history of smoking, obesity, and alcoholism. She is over 40 years old with a cardiac disease, as evidenced by her history of hypertension. She is having a surgery with anesthesia. The prophylaxis is TED holes, SCD, proper positioning for blood flow.
Stage 2. In the recovery room, the patient presents with increased swelling to the left calf with pain and tenderness. The nurse measures the calf muscles and gathers vital signs. The left calf is slightly larger than the right with erythema. The vital signs are as follows: 99 low-grade temperature, pulse of 97, blood pressure of 88/60, which is hypotensive, oxygen saturations of 93, and respirations of 28. The following tests are diagnosis tests ordered by the doctor. D-dimer, diagnostic blood test that measures a substance that is released as a blood clot dissolves. Doppler ultrasound, use high frequency sound waves to show the large veins in the leg and any blood clot within those deep veins. Venography, a liquid dye is injected into the veins to highlight blockage of blood flow by a clot on an image of the legs. This is the most accurate test, but also the most uncomfortable and invasive. A CAT scan, a type of x-ray that gives a very detailed look at the leg veins in cross-section and can detect clots. Magnetic resonance venography, very accurate but usually only used for patients in which venography is ordered but the patient has an allergy to contrast dye. The stage 2 interventions are as follows. You must notify the MD with the current signs and symptoms related to a DVT post-surgery. Once you receive the MD orders of D-dimer, Doppler ultrasound, CAT scan, or magnetic resonance venography, you must implement those orders, and then you must review those results. You must collect the PTT, weigh the patient, and start a heparin drip by protocol. The questions that are asked during stage 2 are as follows. What clinical manifestations did the patient present with? And what initial lab work should the doctor include? The patient presented with shortness of breath, increased swelling of the left calf, pain and tenderness of left lower extremity, and the doctor ordered PTT, INR, and CBC. In stage 3, the patient has been on the heparin drip for about 3 days now, and she has reached a therapeutic PTT level. Coumadin therapy has started, and you must prepare her for discharge. You do assess and do the labs. The vital signs are as follows. Temperature of 98.4, pulse of 82, blood pressure of 128/65, oxygen saturation of 97, respiration of 16, INR 1.2, PTT of 33, and decreased pain and swelling in that left calf. The stage 3 interventions: Coumadin teaching, diet, recommend lifestyle changes, follow-up instructions, discharge teaching. What questions should you ask in stage 3? What should the nurse emphasize for Coumadin teaching? What are some lifestyle changes that this patient can work on? And what is a common complication of DVT? With Coumadin teaching, check for signs of bleeding, avoid green leafy vegetables that may interfere with medication effectiveness. Lifestyle changes: do not sit for long periods of time, keep hydrated, at least drinking 6 glasses of water a day. Lose weight, smoking and alcohol should be eliminated from your daily events, and try to work out. Pulmonary embolism, life-threatening and potential fatal when embolism dislodges from an artery in the legs or pelvis to a lung artery. That's one of the things you can have. If you go back to stage 3, follow-up instructions, discharge teaching. What is the common complication of DVT? Is pulmonary embolism. Just going back for you guys. What are the signs and symptoms of PE? Shortness of breath, nagging cough, coughing up blood, sweating, sudden chest pain, a feeling of doom or apprehension. And these are our references listed here in alphabetical order. We want to thank you so much for your time.
Thank you.